Good evening, everyone, and welcome to our fourth New York State Vaccine Equity Fireside Chat. My name is Louise Square, and I'm the Health Equity Coordinator for the New York State AIDS Institute. I'll be your moderator for the evening. Just a quick overview of what the hour will look like. Next slide, please. We'll have your welcoming and housekeeping. We'll have opening remarks. Then there'll be a panel discussion, followed by Q&A, and then a closing statement and a thank you. Next slide, please. So housekeeping tips and rules. To ask a question, please use the Q&A feature. Type your question into the Q&A box and then tap send. Replies will be seen in the Q&A window and may be answered live, or you may get a response back in the Q&A. If you need assistance during the meeting, please contact privately a staff co-host through Zoom chat feature. You have access to two forms of communication during the hour, the chat and the Q&A. As the panelists and I begin to bring our conversation to a close, or maybe even during the conversation, we'll ask you to put your questions in the Q&A. I know that most of us are used to using the chat, but tonight we're asking that you use the Q&A because it will allow easier access for the panelists and myself to get to your questions. Next slide, please. Now we'll have opening remarks from Tina Kim, Assistant Secretary of Health in the office of Andrew Cuomo.
Hi, good evening, everyone. I just want to thank you all for joining us tonight for this incredibly important discussion. This event is the fourth in a series of fireside chats we are hosting to complement the important work of our state COVID-19 Vaccine Equity Task Force. Our task force is comprised of a number of individuals who serve as key subject matter experts across the state and is charged with developing a toolkit to aid in vaccine uptake in communities of color, the creation of culturally competent PSAs, which stands for public service announcements, and identifying vaccine sites to help meet all the populations where they are. As a Korean American and daughter of immigrants with immigrant family members, the work of this task force is not only personally, but also professionally very critical, and forums like this fireside chat are critical to aid in this work. So I am incredibly thankful to see many of you who have joined us this evening. As many of you know, health experts have projected that in order for us to beat back COVID-19 and win this war against this pandemic, between 75 to 85% of the population need to receive the vaccine, where everyone's kind of focused on how effective the vaccine is. Well, we also have to think about how many in our communities need to receive this vaccine. And as such, New York State has made it a top priority to ensure that vulnerable and underserved communities are not left behind. So tonight's conversation is going to focus on the sharing of very basic but important and fundamental information about COVID-19 vaccines. Our discussion this evening, we're going to explore the questions such as, are the vaccines safe? Are they effective? What side effects could I or my family members experience and should expect? Questions like why we need to continue to observe important public health measures even after getting a vaccine. Do we need to continue wearing a mask? What about social distancing, washing our hands? And what to expect when I go visit a state-run vaccination site. So we hope you find tonight's chat informative, and we thank our incredible speakers and all of you for your attendance and participation. So with that, I would love to hand it back to Louise, our moderator this evening. Thanks so much.
Thank you so much, Ms. Kim. We appreciate you, your opening remarks. Next slide, please. So I'm excited for this opportunity to have this conversation with three highly respected clinicians who work at various agencies within the New York State Department of Health. All of our distinguished guests have done remarkable work in their respective fields and have extensive bios, so we condensed them just a bit for the sake of time and so that we can get to your questions. First, let me introduce Dr. Betsy Rausch Fong. In January 2010, Dr. Dr. Fung took on the role of medical director at the New York State Department of Health Bureau of Immunization. For the past 10 plus years, Dr. Rausch Fung has been overseeing the Bureau's efforts to maintain high immunization rates in order to prevent vaccine preventable diseases in New York State. She oversees school immunization requirements, vaccine preventable disease surveillance, healthcare provider outreach, public education, and other efforts to improve immunization coverage across New York State. Next slide, please. Dr. Alda Osanaga is a medical director in the New York State Department of Health's Office of Quality and Patient Safety, which is responsible for improving the health, quality of care, and patient safety for all New Yorkers. Currently, Dr. Osanaga has been directing her efforts towards the Bureau of Immunization response to COVID-19 related vaccine efforts in New York State. Prior to working for New York State Department of Health, Dr. Osanaga worked as a primary care physician and clinician educator at the Einstein Montefiore Primary Care and Social Internal Medicine Residency Program. Next slide, please. Dr. Charles Gonzalez is an immunologist and infectious disease specialist. He is also medical director of the New York State Department of Health's AIDS Institute. Prior to his time at the health department, Dr. Gonzalez directed immunology and HIV research in his laboratory at NYU. He also investigated hepatitis C therapies, HIV medications, and vaccines as part of the National Institutes of Health AIDS Clinical Trial Group. Dr. Gonzalez is the Chief Clinical Officer for the AIDS Drug Assistance Program, the Sexually Transmitted Infections Program, hepatitis B and C, HIV, and pre-exposure prophylaxis programs, also commonly known as PrEP, all at the AIDS Institute. Dr. Gonzalez believes in syndemics, the idea that a set of linked health problems involving two or more afflictions interact synergistically and contribute to excess burden of disease in population. He considers himself a happy warrior in the ending the epidemic battle in New York State. Thank you all for being with us this evening. During our conversation, we plan to take a closer look at the COVID vaccines. We are inviting our guests to share their knowledge as well as their experiences. Most importantly, we want to provide information with our participants tonight that will help them in their decision-making progress regarding vaccination. We only have a short time, so let's dive right into the conversation. So, our first question. When we talk about the COVID-19 vaccine, there are two topics that go hand in hand: safety and efficacy. So let's walk through these and address them together. Is the vaccine safe? Is the vaccine safe for individuals with compromised immune systems? How effective are the vaccines? And how effective are the vaccines on the market against the new and more contagious variants of COVID-19? I know that's a multiple question approach there, but I think they kind of go together. So I'm going to ask Dr. Gonzalez to please start.
Well, thank you, and thank you for having me. And I'm sorry for that long-winded introduction, Louise. My apology. I'd like less is more sometimes in discussing these things. But are the vaccines effective? I think they're overwhelmingly effective, and effective in a number of ways. One, they're effective in preventing the actual infection of COVID or its symptomatology. And they're even more effective in terms of getting the results back of the multiple vaccines now that are available. As of today, Janssen just submitted also, along with Moderna and COVID, to get the FDA's emergency use authorization. So that should be coming online really soon. They're extraordinarily effective in preventing severe disease and the corollary of serious or severe disease. They prevent death. Okay, I think that is an extraordinarily important issue or point to make is they're effective in preventing illness, anywhere from 85 to 95% effective in the general population or the folks that were in the trials. But uniformly, the vaccines, even the ones that they talk about being 60% effective, and those are not the ones on our plate to discuss today, all seem to prevent severe disease and all seem and do prevent that part that's not reversible, and that is dying from COVID, which is extraordinary given that we're approaching 435,000 people in the United States who have died of this illness.
Thank you, Dr. Gonzalez. And Dr. Rausch, just to follow up on that, we know that we understand that the vaccines are effective, but just talk a little bit about what the efficacy is about against the variants that we're seeing.
Sure. So the major variants that we've seen so far, of course, there's the original strain, and then there's what's called the UK variant that was first identified in the United Kingdom, and has since been identified in other countries, including the US, and the South African variant. Both Pfizer and Moderna have done studies of their vaccines on the UK and the South African variants. And they're estimating that their vaccines have a similar effectiveness against the UK variant as they have against the original strain that has been circulating for the last year or so. They do both estimate that they may be less effective against the South African variant. However, I think that really underlines why it's so important to vaccinate as many people as possible, because the more people that are protected, the less likely there are to be additional, new variants, and the more overall community protection that we'll have against the South African variant or other new variants.
Thank you, thank you. And Dr. Osinaga, can you speak a little bit to the idea of people with compromised immune systems and whether or not this is good for them to take the vaccine?
Sure. So the issue with being immunocompromised is whether you will be able to mount an antibody defense once you get the vaccine. So that is our question. In the trials that were performed for the vaccinations, they often did not have immunocompromised people in the trials, and so we don't have any reason to believe that it would have a different effect on the safety profile. But we wonder about being able to build your defenses to be able to have the immunity response for vaccines that you receive.
Thank you, thank you.
Can I just jump in a little bit? And
Sure.
on that is just, I think everyone needs to know that folks, if they have an underlying immune compromised condition, whether that's multiple sclerosis, HIV, transplants, you're not more likely to get the disease, okay? You're not more likely to get COVID-19. You're just more likely to have a severe illness. And I think that has to be, so the protecting yourself the same way the general public needs to be protected is extraordinarily important if you have a compromised or any compromise in your immune system. And the phrase that we often use is that the vaccine may not take as well. But we do expect, unless you do not have an immune system, that you will have some level of protection from this, from the vaccines. And I think that has to be emphasized.
Thank you so much for that. We'll move to the next question, which is about the Johnson & Johnson vaccine. And Dr. Gonzalez, you alluded to it a little bit. It's close to approval. Can you tell us where we are in the approval process and what's different about the Johnson & Johnson vaccine? Because you talked a little bit about that, the fact that it may only be about 60% efficacious. So can you elaborate on that?
Well, one thing is we have to watch our words, and Dr. Rausch Fung will rap me on the knuckles if I don't say so. We're under an emergency situation. We're not on an enormous pandemic. The country has been hit over the head. So we're in an emergency situation, and the two vaccines that are now being distributed and are so effective are under an emergency use authorization because we're dealing with an emergency. The new Janssen vaccine will also come under that emergency authorization if it gets it, as it gets reviewed by independent panels. It's not a government cabal that looks at it. The great advantage for folks that they think about it is that it only requires a single dose. And so people are looking at it in those terms. Plus, it doesn't have the restrictions that, let's say, the Pfizer vaccine has, that must be kept under ultra cold conditions, or the Moderna vaccine that must be kept under those conditions. So it's much easier to move around, okay? Much easier for the pharmacy to stack it, on the shelf, the same way you can get your influenza vaccine at the pharmacy in New York. So it has those advantages. And I think Dr. Rausch Fung is dying to enter into this discussion.
Please do.
Yes, I mean, I absolutely agree that it has less restrictions on the storage temperatures, the freezing temperatures. It will be easier to stock than certainly the Pfizer vaccine, which has the ultra low storage requirements. And I think it is really, really key that it is a single dose vaccine. So as Dr. Gonzalez mentioned, there is an independent panel that will review it and then advise the FDA. Then the FDA will make an determination on whether to issue an emergency use authorization. And then after that, the CDC also works with an independent panel who will review it and make recommendations. So, since it is breaking news with the filing, I'm not gonna take a chance on predicting how long that will take, but hopefully it will be soon.
Thank you. Dr.
And
Osanaga,
Marie?
did you want to weigh in?
Oh, yep, just one additional thing. So the FDA expects that all the manufacturers that have gotten emergency use authorization for their vaccines, so Pfizer and Moderna, and if it happens with Johnson & Johnson, that they do go on to apply for licensure, which is, the approval when we say that it's FDA approved. So that is the expectation. And really what they're going to be looking for is just follow-up data, longer term follow-up of the folks that are in the trial. So the trials are still ongoing. They're supposed to be going on for 2 years. And the manufacturer should be applying for licensure approval when they have the data.
Great, thank you for that. I think we have a question from the audience. Ashley, do you have a question for us?
Yes, we have a question from Patricia Fernandez. Is there also a Brazilian variant? And if there is, what is known about the efficacy of the vaccines against it?
Yes, there is a good point. There's also a Brazilian variant that has been identified. I have to admit that the studies I've seen on the variants have mainly focused on the UK and South African variants. I don't know, Dr. Osanaga or Dr. Gonzalez, have you heard much about efficacy against a Brazilian variant?
No, but we should note that platforms very similar to the Janssen, the Johnson Johnson that is expected to, which has been presented to the FDA for emergency use authorization. Similar platforms have been used in Brazil, and before they discovered the variant, and have been shown to be effective. That is hand waving by a doctor who is unwilling to admit he doesn't have all the data in front of him because it hasn't been published. Okay, folks?
Thank you, Dr. Gonzalez. Did anyone else, Dr. Osanaga, did you want to weigh in?
I have nothing further to add. Thanks, Louise.
Okay, so we'll go to question number 3. So there are a lot of concerns around side effects after taking the vaccine. Can the 3 of you kind of outline what are the most common side effects? How common are they? And what are some of the more serious side effects? We've heard of reports of Bell palsy. We've heard reports of, folks kind of not doing well and kind of having to stay put after a while once they receive the vaccine. So can you kind of go through some of those with us? I'll start with Dr. Osanaga since you didn't get to weigh in last time.
Sure, thanks, Louise. So I think the more common side effects are side effects that you all have probably had potentially after other vaccines. Soreness at the site. It's given just like other vaccines in the arm, the upper arm. Potentially some soreness, some fevers. Some folks have been having, or more folks have side effects after the second vaccine than after the first vaccine. So I think there might be a chance that you were fine after the first vaccine and had some more side effects after the second. But Louise, you bring up a good point too about what other things can happen. And one of the severe side effects that I'm guessing a lot of people have read about, at least for the 2 vaccines that have that are currently authorized and being given, is anaphylaxis. And so we actually, when we first heard about data for anaphylaxis, was thought to be 11 events per 1 million doses given. And now, as we've given more doses and have reporting, there's active reporting being submitted about anaphylaxis. The risk has actually become half. It looks like, I shouldn't say the risk, but it looks like the events, it looks like it's maybe now 5 in 1 million doses. So I think that's your more serious side effect. And the FDA, the manufacturers, have required that in the place that you go to get your vaccine, that they have the ability to respond, to react, to treat, to help you if you were to have one of these serious side effects. I think that's very important for everybody to know. And also, after you get your vaccine, you will be designated whether you have to be observed. And if you've had a history of a severe response to any IV medication, injectable medication, or a vaccine, or if you had anaphylaxis, anything, it's important to tell the person who is vaccinating you that, so they know that, and so that they can watch you closer and for a longer period of time. So I just want to make sure everybody knows that. I'll let my other colleagues respond or add to what I said.
Thank you. Does anybody else? Oh, I'm sorry, go ahead.
No, I think that Alda summed it up really well. A lot of people are reporting fatigue after the vaccine, and so that is something to be aware of and plan for in advance before you go in for your vaccine. I heard you asked about Bell's palsy. During the clinical studies, when the FDA issued their emergency use authorization, they looked at data from the clinical studies that have been submitted to date, and they felt in their estimation that the rates of Bell's palsy were similar to what would have occurred naturally in a group that size, regardless of vaccine. But it is something that the CDC and FDA are continuing to monitor closely, and if they find that it is happening at a higher rate than they were expecting, then they will share any changes to the recommendations or any updated information.
Thank you. Thank you for that.
I'd just like to add that the feelings that anyone who's gotten the shingles vaccine would probably give you the exact same history of side effects that we're getting with the two now emergency use authorized, the Moderna and the Pfizer vaccines, both in terms of feeling a little crumpy the next day. That's a severe medical term, feeling a little crumpy the next day, to the soreness in one's arm. So there's that. There's an element that even an august panel that you have before you, these things that we're talking about are stuff that we're supposed to look at with every vaccine. Okay, this is something that everyone we should be doing. We just we're so used to getting vaccines in the pharmacy. The children get vaccinated and you walk out. But this is what is being looked at and being incredibly careful about, is because we're dealing with something. We're dealing in an emergency and something new. But everything that we talk about, whether it's hives or anaphylaxis, we're supposed to be looking at this with every vaccine that we give. And so there is that, in that way, it's not a departure or nothing scary from previous vaccines that we give. We've just gotten used to it and know it can happen. And that's really, from a medical point of view, is the idea that we know it can happen, so we're worried about it, especially when we're doing mass inoculations. And we're not used to, in this country, to do mass inoculations, and in places that are not in hospitals or not prepared nearby.
Thank you, Dr. Gonzalez. I mean, I think that's a really important point. I didn't tell Dr. Rauschbaum, Rauschbaum that when I started my career in the health department, I started in immunization. And so, yes, we know that you are supposed to be looking for these things with any immunization. So thank you for bringing up that point. So I'm going to go to the next question. And the next question is, should individuals who recently tested positive for COVID antibodies still consider taking the COVID-19 vaccine?
Louise, this is Alda. I can. Oops.
I'm sorry. I should have asked for someone. Dr.
I'll volunteer.
Oh, Dr. Yes, please go ahead.
I'll volunteer, Louise.
Okay.
Because I found my unmute button and it's hidden, so it's harder for me to unmute. So I've got it. So the question was about antibodies and whether you can or you should get vaccinated again. And I think so the answer is yes to that. The thing that we still need more data on and to understand is, when you have antibodies, especially if you've had a test for antibodies, what does that mean? And does that offer you protection? And I think that's something that we're still trying to understand. And so we know that the vaccines and the trials were given some people who had antibodies. So recommendation is that you can consider it. I think there's something else important here to discuss too, is that the CDC says that if you've had an infection, if you've had COVID, and it's been 90 days and you're in that 90-day window, that reinfection is uncommon. So we think that getting COVID again is uncommon within those 90 days. So they say that you can consider delaying your vaccine for 90 days, but it's a consideration. If you don't want to delay, you can always get your vaccine at that time too. What we know about antibodies is you can test antibodies. What we don't know is if, and I think Charles will be able to talk more about this, is if the antibodies that we can pick up that you have are neutralizing antibodies. So antibodies that will work against and protect you from the illness. And we know that the vaccines, that's what they test for, is to see if you make neutralizing antibodies. So we know you have antibodies. Are they neutralizing or not? It's something we still need more data on. And also, is there some threshold level that you need of antibodies? It's something else that I think that everybody is looking into. So maybe a little bit more than everybody wanted. I think, again, it's if you've had COVID before, if you have antibodies, you can get the vaccine.
Thank you.
And that key is that all the vaccines have been developed so that they elicit from someone's immune system neutralizing antibodies. In other words, the neutralizing antibodies, the shorthand for that are antibodies that actually work and protect you. Your body, when you get any infection, makes a slew of antibodies. It throws the kitchen sink at the invading microbe, the invading virus, the invading bacteria, but only certain of them actually work to stop it in its tracks. And those are the neutralizing antibodies, and those are the ones that the vaccine elicit. So that's it. And some of the tests for antibodies are they'll just catch anything that looks like it, and you can get false positives. Also, we know that folks that get asymptomatic infections are less likely to have super high neutralizing antibodies. Okay, and so, you know, in other words, everyone should get vaccinated, even if they think they may have been protected in the past.
Thank you. Dr. Rauschwang, did you want to respond to that as well?
I think they handled that really well. I did want to, I apologize if this is a repeat of Dr. Osanaga, but in the clinical studies for Moderna and Pfizer, they did also look at the safety in people who had previously had antibodies against COVID-19 because there were some research questions about whether they would have the same safety, and they didn't find any higher or unexpected side effects in people who had antibodies against COVID-19 compared with people who didn't have antibodies against it prior to the vaccine. Excuse me. So.
Okay, thank you. Thank you. So we're going to go to Ashley. Ashley, you have a question?
Yes, there's a question from Heather Kuchia, actually two that's follow up to this conversation. Is it safe for someone who has had COVID-19 to receive the vaccine since they may have lasting effects from COVID-19? And also, how long after they have had COVID-19 is it safe for them to receive the vaccine?
Dr. Gonzalez, do you want to start?
Well, sure. Someone who is a long hauler, if you will, it does not appear that they have the virus in their system, that their immune system is reacting to something or has been reset. So that discussion on whether or not they want to prime their immune system, if you will, with a vaccine has to be taken into consideration and discussed with their primary care physician. Many folks that have what amounts to chronic fatigue-like syndromes often take immunoglobulins, and immunoglobulins will interfere with a vaccine. And so that is another consideration. Okay. And it also depends what type of symptoms one is talking about, if and the effect. That has not been looked at as closely as we'd like. The NIH actually has a trial looking at folks with long haulers with COVID. And of those, some of them will be vaccinated if they so choose, but the data is a little off. What was said previously that 90 days afterwards would seem reasonable if someone is not having any long-term symptoms. But in point of fact, we don't know. And we don't know if it'll exacerbates one's symptoms if they have that. We just don't know. um, the what the types of antibodies that may elicit the chronic fatigue-like symptoms um, have not been identified, if there even are antibodies, and not just a natural reset of the immune system. Again, a long-winded way for the doctor to say, I don't know.
Thank you. Thank you for your honesty. Dr. Rashfong, did you want to weigh in?
I think that Dr. Gonzalez made some good points that there are some things that weren't addressed in the initial clinical studies. As Dr. Osanaga said, they are meant to, or they are planned to continue for 2 years, as well as there are other clinical studies, such as Dr. Gonzalez alluded to. So we may have more information in the future. One thing he mentioned, although in a different matter, some people are treated with either a monoclonal antibody or convalescent serum for COVID-19 infection. And we have found or that antibody treatments can potentially interfere with the body's immune response to the vaccine. So CDC is recommending that specifically if people had one of those antibody treatments, the monoclonal antibody or convalescent serum, that they wait 90 days afterwards before getting the vaccine so that it doesn't interfere with the vaccine. For people who didn't get that treatment, the CDC hasn't identified a minimum interval, but as Dr. Gonzalez said, that there is more information that I think will be gathered in the coming weeks and months and years as further research happens.
Great, thank you.
But if someone is asymptomatic and has had COVID in the past, I believe the three of us would recommend that they get vaccinated.
Yeah, I agree.
So one of the common criticisms that we hear, the most common and creates a lot of skepticism, is around the speed with which the vaccine was created. So the original name of the vaccine effort from the federal government was Operation Warp Speed, and that certainly didn't help anything. So how would you address this, especially if you were talking to an individual about getting the vaccine?
Yes, I definitely appreciate a lot of people have concerns, and the name of Operation Warp Speed certainly didn't soothe those concerns for some people. But there are a couple of things that are important to keep in mind. And first is that once the virus was discovered, the SARS-CoV-2 virus, researchers rapidly shared the information, its genetic code, all over the world. There have been other outbreaks, certainly not as large as this pandemic, but other outbreaks on other coronaviruses, like if you remember SARS, about 17 years ago now, I think. And there have been efforts over the years to develop vaccines against other coronaviruses, as well as other related viruses. So in many cases, researchers who had started doing work on a vaccine were able to take this genetic information on the new SARS-CoV-2 and sort of pivot and change their focus to developing a vaccine against COVID-19 rather than starting entirely from scratch, building off of their existing research. And then also in many ways, many of the steps of the not only research and development, but manufacturing processes were done at the same time instead of sequentially. So ordinarily, if there wasn't a pandemic going on, most manufacturers would wait until all of their studies were done and the FDA had approved their vaccine before making a large financial investment in factories and so on. But with Operation Warp Speed, the federal government actually put in that investment early on before the studies were even done, so that once the emergency use authorizations were issued, the companies were already ready to start distributing. Whereas under more routine conditions, there's usually a little bit more of a lag time between FDA approval and having large volumes of vaccine available across the country.
Thank you for that. Dr. Osinaga, do you want to try again? No. Oh, we still can't hear her. I'm so sorry about that. Oh, we can get your sound back up. Dr. Charles, did you want to weigh in on that one?
One that pharmaceutical companies have been very reluctant to develop vaccines. It just period. They're very reluctant to do it. They can't make enough money out of it. Okay, the last one that was approved was to prevent papillomavirus, to prevent warts and cancer, cervical cancer, and some forms of rectal cancer, and that took years. As Dr. Rochefort has said, the Pfizer vaccine took the platform that was being used and developed in for SARS, for SARS and MERS, and switched out, because they are both coronaviruses, and switched out the small aspect of the current COVID-19 spike and placed it in. So the technologies for a lot of the technologies that we've been using, many of them are using adenoviruses, and they cause about 5% of colds, and we've got about 57 adenoviruses, and we've used those for HIV vaccines, to try to use them for Zika vaccines. So these things have all been there, and those platforms have all been studied. There've been over 400 clinical trials using these platforms in different means. It's quite extraordinary, the reluctance, and what was done was to take the chances, running things in parallel as opposed to running things sequentially, as Dr. Rochefort said, has helped enormously in putting things to market. But the federal government in the United States, the European Union, took a lot of the financial risk of this out of the way. And some companies didn't take full advantage of that risk, all right? And others are financed pro bono to begin with. The AstraZeneca, the Oxford, vaccine, for example, was set up, was working so that it could be distributed at cost throughout the world. So there are those aspects. Yes, it was done quickly, which the original name that we had wanted for warp speed was Manhattan Project 2. Okay, that was the original name. MP2. Why? Because we developed an atomic bomb in less than 2 years. It was that fast. Okay, and it was that model where you try to run things parallel as much as possible, as opposed to the go slow, because if it doesn't look profitable, if the market does not look good, you stop. These are decisions that businesses have to make, but governments, in terms of emergencies, have to go on a full court press. And so those things helped bring this to fruition. If I can just give another example, all right, we use eggs to make our flu vaccine, all right? We've been using that technology for over, 40, 50 years, whereupon that's because pharmaceutical companies can't really make money on it. There's other technology that can make it faster and probably safer, all right? Because we always ask, are you allergic to eggs before we give you the flu vaccine? there's a reluctance to go into that field that the government realized that both the US, the European Union, the British government realized that this was such an emergency that they had to underwrite some of that risk.
Thank you, Dr. Gonzalez. Please, if somebody on the back, and if you let me know whether or not Dr. Osanaga is back up and running, I'd appreciate that. So I'm gonna move back a little bit, kind of similar to the conversation that we were having about whether or not there are times when being vaccinated is contraindicated. But so there are emerging and contradictory opinions from the CDC and the World Health Organization on the safety of vaccines for pregnant people. What is the current thinking and what do we know so far?
So first to acknowledge neither the Pfizer nor the Moderna studies included pregnant women during the enrollment. They didn't. They actually did pregnancy tests, and they didn't include women or people who had positive pregnancy tests. However, nonetheless, by the time that they had their data ready to send it to the FDA, there were about 24 or so between the two companies, participants who had nonetheless become pregnant, some of whom actually had, in fact, been pregnant before getting the vaccine and just didn't realize that their test, perhaps was a false negative. That's a very small number, and they're going to continue to study them more over time. So there isn't a large amount of data yet on the specific safety in pregnant people. However, we know that pregnant people are one of the higher risk groups if they do become pregnant to have more severe course of COVID-19, and possibility, it's not as clear in the data, but possibility that there could be pregnancy complications among pregnant people who get the COVID-19 infection. So when we make decisions in medicine, and when we don't necessarily have all the information, we have to look at what are the risks and what are the benefits. And because pregnant people are at such high risk for COVID-19, if they get the infection, the CDC has said that if pregnant people are in a priority group, such as healthcare workers or one of the prioritized phase 1B groups or other groups as that expands in the future, CDC has said that they can get it. The World Health Organization was a little bit more conservative in their recommendations, although they did say that pregnant healthcare workers can get the vaccine if they want it. They weren't quite as expansive as the CDC. I think it's also, though, important to note that the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine, who are two of the expert groups in pregnancy medicine in the United States, but together they issued a joint recommendation that pregnant people should be offered the COVID-19 vaccine and have the opportunity to get it if they're otherwise eligible.
Okay. So we have about 10 minutes left. Unless Dr. Gonzalez wants to weigh in on that one, I will go to the next question.
I can't help myself, but I do want Alda to talk if she can.
I know. Can you speak yet, Dr. Osanaga?
Did it work?
Yes.
Can you hear
There
me?
you go. Okay, so I'll direct the next question at you, unless you wanted to add weigh in on the one about pregnancy.
I don't have anything to add to Dr. Rauschwang's answer, so I'm okay. Thanks.
Wonderful.
But I do. I have I'm sorry. I have vaccinated quite a few pregnant women with the Pfizer vaccine, just as an example, and it's the concern is not for the baby. It's not, when really not concerned about the developing embryo. What we're concerned with is if a woman has a bad reaction to the vaccine, we could precipitate a miscarriage. And a miscarriage in someone who wants their child is a tragedy, okay? And is carrying, and there is the concern, because as Dr. Roche, when you're pregnant, you're actually immunosuppressed. So if you were to get sick, both you and the developing child could suffer some incredible consequences from the inability to get oxygen into your system. But the real concern and the real discussion has to be that if you have a reaction and you're pregnant, that you may lose the child that you're carrying. That's the sort of rubber meets the road discussion, rather than worrying about some non-existent changes that might happen to the child with any of these vaccines.
Thank you so much. So we only have about 8 minutes left. I'm gonna direct my next question at Dr. Osanaga now that we have her back. There are numerous locations the public can go to get vaccinated. Each of the three of you have worked on the state vaccination sites in varying roles. Can you please talk us through the process at the state vaccination sites? What do the sites look like, and what can folks expect when they get there?
Sure. So the pods, we call them pods, point of dispensing sites that are run by the state are in various parts of New York State, and the majority of them are inside, but we do have a couple of pods where you can drive in your car and get vaccinated in your car, sort of like a drive-through. But they're all set up, I think, in the same way. There's registration, which is the first part you'll go to. You'll have an appointment. You'll go at your appointment time. And at that part, you'll also, just so everybody knows, you're going to be screened with a temperature, and you're going to be asked 3 questions. The questions will be if you recently have, or if you are currently have COVID, if you have had contact with anybody with COVID, or if you've traveled outside of New York State, outside of the contiguous states within the past 10 days. And so the reason that we ask those questions is to just make sure that that if you potentially might have an exposure, if you have COVID or have had an exposure to COVID and have been told that you need to be in quarantine, that you're not entering the site, because there's a lot of people. We want to make sure that everybody is protected from getting the disease. And the other thing when you go to the site is to wear your face mask. And so you'll register in. You'll see probably lots of different stations. Those are your vaccination stations. You will have, when you registered, you probably answer some screening questions. Those will be reviewed again, just to make sure we understand if you have any contraindication to the vaccine, meaning that you shouldn't be receiving the vaccine. If you have any questions, you can ask your vaccinator at that point. You will receive a 5 or 6 page, depending, information sheet on the vaccine. You'll have time to review that and ask if you have any questions on that. You'll receive the vaccine, like we talked about. The vaccine goes on upper arm, and then you will go into an area where you'll be observed. We talked about that too in the beginning. Depending on, most people will do 15 minutes, but depending if you've had a risk of severe allergic reaction and anaphylaxis to certain things, you'll be asked to watch for 30 minutes. And then after that, you'll have your appointment for your next dose. It's really important to get your second dose, make sure you complete that series, make sure that you have to make sure that you can build up that immunity. And you should come back to the same appointment, the same site again for your second appointment. It's important to go back to the same place. And you'll have a card that they will give you that will tell you exactly what vaccine you got, because you should also get the same vaccine. If you got Pfizer the first time, you should get Pfizer the second time. If you go to the same place, that really guarantees that. And we want to make sure people get the same manufacturer, the same type of vaccine for both doses. I think the only other thing I want to tell too, if you go to a state site, is that you'll be asked your insurance information, but the vaccine is free. You shouldn't pay for a copay, any part of that. But there may be billing of your insurance that you should not have any responsibility for paying for anything. So I just wanted to make that point too.
Thank you so much for that. That was, and especially that last point, that's very important. So we have like 2 minutes left, and I'm going to ask this last question, and I'm going to ask each of you to respond as quickly and concisely as you can, because we want to make sure that we respect people's time, and we want to thank folks for joining before we get off. So the last question is mostly why we're here, why this panel, this series was created. Why is it important for individuals to support and take the vaccine? And what is the special significance for people of color? Doctor, we'll start with you again, Dr. Osanaga, since you've had less airtime.
So I think you've heard from all of us tonight how, and I think in the opening comments too, about how it's important for us to be able to build this immunity, this community immunity, to keep all of us safe. I think in our opening comments, it said, 75 to 85% of people will need to be vaccinated so we can curb the disease. Dr. Rushfund talked about how when more of us are vaccinated, can help protect us from all different variants, or potentially even prevent some variants from really being able to duplicate and replicate in the community. I think when we talk about this vaccine and the decisions to make it too, it's really it's looking at the benefits and the risks of getting severe disease. Dr. Gonzalez talked about the risk of death, and this vaccine can prevent that. It's pretty amazing. I think we were all overwhelmed, gratefully overwhelmed by how effective the vaccine is, and the trials showed, when the FDA thought about this, they really wanted the vaccine to show at least a 50 to 60% efficacy. And when we saw that it was, 85, 95%, it was just really overwhelming to us, and we were happy to see that. So the vaccine, when you think of what can prevent from serious disease, prevent from going to the hospital, prevent from death, and then thinking about the risks. And you're right, there's a lot of unknowns here, right? The vaccine is new. We are learning more and more about it every day. I think as time passes on, we'll learn more and more about it. So really thinking about, for you and your family and your community members, your neighbors, thinking about what it is that we know about the vaccine, what can it prevent? And, and everybody has also their own personal history of conditions, medical conditions, and thinking about what your risk is and what are potential benefits here into protecting yourself and your family.
Thank you. You, Dr. Rosh, you have 30 seconds, and Dr. Well, actually, I'm so sorry. I wanted to hear from all of you, but we're kind of out of time. But I want to take this time to thank our panelists for being here. Thank you, Dr. Roshfong. Thank you, Dr. Gonzalez. And thank you, Dr. Osanaga. The discussion was amazing. We appreciate all of your knowledge and your willingness to give us this information. I'd like to thank you, all participants, for being here. I'm sorry if we didn't get to all of your questions, but there should be a link in the chat to a frequently asked questions document that may answer some of the questions that were in the chat. So thank you, everyone, for being here, and we'll see you at the next Fireside chat. Thank you, doctors. Have a wonderful evening.